Well, welcome, and thank you all for joining us today to discuss this important topic. My name is Terry Dean, and I'm the President and CEO of the Canadian Lung Association. Though this is an online event, today I'm joining you from Ottawa, the traditional unceded territory of the Algonquin and Anishinaabe people. I'm proud to have called this area home for much of my life. Today we're here to discuss air pollution and lung health. The Canadian Lung Association has been the chief advocate for Canadians' lung health since 1900. As we've been presented with different challenges over the decades to lung health, we continue to work with like-minded organizations and experts to make Canada a better place to breathe in for all. Air pollution is one of these challenges. In Canada, there are approximately 14,000 deaths attributed to air pollution each year and countless breathing issues. This is simply unacceptable, and it's time for all of us to work together and seek new solutions and recommendations to address this growing challenge. We engaged Abacus data to learn more about the impact of air pollution on Canadians' health and inform our next steps towards amelioration of the issue. We're excited to be here today to have a frank and meaningful discussion with some of Canada's leading experts on the topic and develop a path forward. Please help me welcome our esteemed panel of experts. Dr. Chris Carlston is a professor of medicine and head of respiratory medicine at the University of British Columbia. Dr. Carlston holds the AstraZeneca chair and is the Canadian Research Chair in Occupational and Environmental Lung Disease. He's a director of the Air Pollution Exposure Laboratory and the Legacy for Airway Health, the theme lead for personalized health in the UBC Faculty of Medicine, and also holds positions at the Peter Wall Institute for Advanced Studies, the UBC School of Population and Public Health, and the Center for Lung Health Innovation. Welcome, Dr. Carlston. David Peterson is the Vice President of Corporate Environmental Affairs for General Motors of Canada. David leads communications, government, and environmental relations for GM Canada. He's also a member of GM's global public policy and communications teams. His areas of expertise and responsibility for GM Canada include international trade agreements, climate and carbon policy, electricity costs, vehicle greenhouse gases and electric vehicle regulations, and safety regulations, among others. Welcome, David. Evan Wiseman is the manager of climate policy for the Atmospheric Fund. As climate policy manager, Evan leads task policy and advocacy work. He has worked for elected officials provincially, federally, and within his role as a government relations firm in Ottawa. Outside of the world of politics, Evan has worked for the Ontario Centres of Excellence, supporting its innovation agenda, and as a researcher at the University of Toronto. Welcome, Evan. Dr. Joel Vypond is the president of the Canadian Association of Physicians for the Environment. Dr. Vypond has worked as an emergency physician for 20 years, currently at the Rocky View Hospital in Calgary. He was a spokesperson and strategist for the Alberta Coal Phase-Out Movement, and more recently, the Canadian Coal Phase-Out Network. He is the president of the Canadian Association of Physicians for the Environment, co-founder and co-chair of Calgary Climate Hub, and the co-founder of #MasksForCanada. Welcome, Dr. Vypond. And last but not least, Melanie Longeau is the incoming president and CEO of the New Brunswick Lung Association. Before joining the New Brunswick Lung Association, Melanie worked as a human health and ecological risk management scientist and led the development of indoor air assessment methodology for contaminated properties in Atlantic Canada. The New Brunswick Lung Association leads environmental health and clean air initiatives to reduce health risk and climate change and pollution. Welcome, Melanie. Now I will pass the proverbial mic to David Coletto, the CEO of Abacus Data, who will present our initial public polling information and moderate today's discussion. David, over to you.
I'm on mute. Look at that. Good. Thank you, Terry, for the introductions. Welcome to all our panelists. It's a privilege to be sharing. I'm coming from Ottawa, and good morning and good afternoon to everybody who's joined us here today. Before I get into those polling data, though, I'd love to go around the table and have everybody. You've heard their bios, but maybe hear directly from our participants about just a few initial thoughts on why they're here and what they think about the issues that we're going to explore today. So in no particular order, Dr. Joe Vypond, I'll start with you from Alberta.
Yeah, so as an emerge doc and certainly through medical school, there's really no training on air pollution at all. So when I started to get involved in the coal phase out work in Alberta, I really had to take a crash course, almost like a mini fellowship in air pollution, and learn as much as possible. And there's so much to learn, and the impacts were so impressively earth-shattering that I've found that it's been useful in many aspects of my career, not just with climate, but also, speaking out on new builds of fossil fuel plants. And hey, this panel today. So it's an honor to be here.
Thanks, Joe, for joining us. David Peterson from GM, great to see you.
Thank you, David. Yeah, it's also an honor for me too. It's great to be here working with partners like the Lung Association. These issues of pollution and just our health are so important. I would say I've worked much of my career in the auto industry. I'd say that the auto industry has been part of the problem for many, many years and had to use technology to be able to move ahead. And I'm really proud to be part of an industry and part of a company that now has a very clear goal and vision to take the automobile right out of the equation and have it be a zero emission vehicle. So all our General Motors vehicles, our ambition is to have them be battery electric that we sell by 2035, and we're rapidly moving on that area. But it's going to take a village to get there. There's a lot more than just the availability of the technology that we need to get through. So we'll have a good conversation.
Great, David. Thank you. To Melanie, coming from New Brunswick. Great national panel here, by the way.
Thank you, David. I'm so happy to be here today. The New Brunswick Lung Association has long been a leader in environmental health initiatives in support of our vision of all people free of lung disease. As everyone on the panel here knows today, the air we breathe and the environment in which we live are very influential on our health. So I'm so happy to be here today to be part of this important conversation, and I really look forward to our discussions.
Great to see you, Melanie. Dr. Chris Carlston, you're coming from BC. How are you? Good to see you.
I'm doing well. Really, really happy already, just what I'm hearing. I want to echo what Dr. Vypond said about the training not being really sufficient at all. Although I was lucky, I guess, that early on, I really started my educational focus on environmental science, and I also had ambitions to be a physician. And while that wasn't for many a natural juncture, I had enough mentorship amongst a limited group that thought likewise in my early days to sort of find a way. And since we inhale about 10,000 liters a day, each of us, into the lungs, it was natural for me to specialize in the lungs, and ultimately UBC was supportive of that, and now a growing group, including the Legacy for Airway Health that you saw, and pointing that out because I'm learning along with others that really it's about working with the community together rather than in isolation. And I think that's part of the reason we're here today. And I finally want to, there's lots to say about this, but without going on too long, I want to thank David, because that step by GM has been really impressive to me. And some of you may know, or if you don't, you can look up the Health Effects Institute. And it's an influential group in the US, but I wish they would, the auto industry affiliated with that would be as progressive as GM is setting that example. So kudos there. Looking forward to the discussion.
Thanks, Chris. And certainly not least, Evan, coming us from around Toronto. Evan, good to see you. How you doing? Good. Thanks for having me. My name is Evan Wiseman. I'm the Climate Policy Manager at the Atmospheric Fund. A little bit really quickly about the Atmospheric Fund, since not a household name generally, but we operate in the general Toronto Hamilton area, and we advance climate concepts by investing and providing grants and advocating and implementing programs to get the GTHA to net zero by 2050. And recently, through the LC3 network, sister organizations like TAF are going to spring up across the country from Vancouver to Halifax. So we're really happy to see that.
on climate and our health, TAF does an inventory every year where we track our emissions in our region. And so for those that are interested in it, they can go on our website and they can check our inventory out. But overwhelmingly, our emissions come from two key areas, and they're areas I'd just like folks to remember for a little bit later, but it's buildings and transport. The overwhelming preponderance of our emissions are where we live, where we work, and then how we move between those things, those two areas. So that'll be mostly where my comments are on, and those are where most of our efforts are focused on too. So TAF works with organizations from for-profit to nonprofit, government, and everyone in between to get those emissions down.
Thanks, Evan. And yeah, thank you everybody again for being here. Just quickly, my name is David. I am the Chief Executive at Abacus Data. We're a market research and polling firm based in Ottawa and Toronto, and it's been a pleasure to work with Terry and Sarah at the Canadian Lung Association on some research we did that I'll share with you in a moment. But I think one of the things that we have learned, and we'll talk about perhaps the impact of the pandemic and its impact on how people think about this issue and how do we respond to a crisis, and our willingness to move fast and quickly and boldly, I think is evidence that not only our governments can move there, but certainly individuals can change their behavior pretty quickly when we're asked to and when we realize it's in our best interest. So there's lots that we can learn and take away from the last 16 to 17 months. That being said, I'm going to dive into some public opinion research in a moment, but for all of you who are on the webinar today, welcome again. And we've got a great mix of people from governments, both federally and provincially, folks from the nonprofit environmental sector, from many lung association reps across the country, and I think a number of just interested individuals. And so we're really looking for you to provide some input and questions. So once I'm done presenting a little bit of data, we'll start a conversation. But if you've got a question at any moment, you can use the Q&A function in Zoom. You can chat with others in the chat function, and I'm going to try to, as best I can, integrate any comments or questions you have. Ultimately, the goal here, as Terry said, is to take what we've heard from our panelists, any feedback we get from participants, and the Lung Association is going to build out a white paper and try to drive action and bring people together and really raise people's attention to the link between climate change and lung health, which, as I'll show you in a minute, is not obvious to people across the country. And my view is the more you can link health outcomes with climate action, the more you're going to build support for climate action, generally speaking. And so that will be a big part of our conversation. So let me get into some of the polling data. And I think, as I've alluded to, I think there's some really important takeaways about where public opinion is. This was a large national survey that we did, commissioned by the Canadian Lung Association earlier this year. So the survey was done in January. We interviewed online 2,000 Canadian adults, a representative sample, weighted to match the population by region, age, gender, official language, educational attainment, and I think I said gender. If I didn't, I want to make sure I do. And so this large sample size, as you'll see, allows us to really look at regional differences across key demographic groups. And also, because we're going to talk a little bit about politics, it seems, at least being here in Ottawa, that we're inching our ways to a federal election. And so I suspect that climate change, like in 2019, will play a prominent role in the conversations that our political leaders have and the country has in terms of what comes next. I break out some of the results by partisanship. Now, for me, the three key takeaways from the data is, first of all, there is broad concern about air quality across the country, whether we talk about indoor air quality or outdoors, but it's not universal. And so the data really signals to us that there's still work that needs to be done to raise awareness about the issue and its importance in not just our overall health, but specifically the health of our lungs. One of the things that's important is to recognize, despite the fact that almost 60+ Canadians believe that climate change is a crisis, concern about it and its effect on our day-to-day life continues to grow, and we've been tracking this with other work we've done for years, that not all Canadians right now see a direct link between their own health and the changing climate that we're experiencing. They expect it to have an impact, but they're not quite ready to feel that it is. And so understanding that gap, I think, is important. Lastly, because ultimately we're looking for policy solutions, one of the things that's become very clear to me over the last few years is that there is bold and broad support for government action on a range of areas, whether we're talking about EVs, and David will speak to that from GM's perspective, or individual things we can do, or big policy changes that the governments can push us. So here's a quick snapshot of what we've learned. When we ask people across the country, how concerned are you about getting COVID-19? Aside from those concerns, given that we did this survey in January, is quality in the following locations something that you're very concerned about, somewhat concerned about, not very concerned about, or not all concerned about? And you can see the kind of ordering here. Far more people say they are at least somewhat concerned about air quality indoors in public spaces. That might be somewhat of a leftover, given that we've been really sensitized to thinking about air quality during this pandemic. But if you go down that list, the air quality outdoors, air quality in your home, you do find large numbers who say, I'm quite concerned about this. On the other hand, and I'm be curious to hear from our panel on how they feel about this, you also have about half the country who says, I'm not that concerned about it, right? And so I think this signals to us a need to understand why aren't people worried about air quality as much as maybe they should be, and the importance of raising this issue and getting people to understand how vulnerable we are actually, especially as climate change continues to progress. Now, when we look at, for example, the quality of air indoors and public spaces across gender, age group, region, we see some variation. Certainly women tend to be more intently worried about this than men, older Canadians slightly more than younger. But for the most part, the differences we see, whether we're talking regionally or even politically, if you see that bottom set of data, is we see differences of what I call degree and not direction. And so there's fairly consistent results depending on who we're talking about and where they live. Similarly, when we talk about air quality outdoors, we see heightened concerns in British Columbia, in Ontario, for example, than compared to the prairies. But again, not huge differences in those areas. We do see, however, a political difference. You can see those that voted Conservative in the last federal election less likely to be concerned about air quality outdoors than, say, those who voted Liberal, New Democrat, or for the Green Party. We see the same kind of pattern when we look at the quality of air in their home. So all in all, a sizable number are concerned, but I don't think yet a number that should be, given the data that we're going to hear from the panel today. Now, when we ask people which of the following best describes how climate change is affecting your health, 1 out of 3 Canadians say that they believe that climate change is directly impacting their health because of poor air quality and the higher risks of floods, forest fires, or storms caused by climate change, right? So that's a good starting point. On the other side of this, 15%, not an insignificant minority, don't think climate change will have any impact on their health going forward. That's the group that we consistently see may not even believe climate change is something for us to worry about, and therefore they don't believe that. They're also not going to believe that there's direct links to their own personal health. But the most important group in my mind is that big 55% in the middle, who right now don't think there's a direct link between their personal health and climate change, but they are worried that it's going to happen, and that they believe that in the future, they're going to see impacts on themselves and future generations. And so that 55% is the key group, that they expect things to get worse, but they're maybe not quite sure why or how fast those impacts are going to come. And when we look at, again, this across some of our key groups, British Columbians in particular are much more aware, I think, because of the prevalence of forest fires and the impact that that's had on air quality. It carries over a little bit into Alberta, but Albertans and those living in Saskatchewan and Manitoba, and Joe, you can speak to this as our resident Albertan, have for not everybody, but sizable numbers have quite different views when it comes to climate change. And it's driven in part by politics and concerns about economic well-being and the health of the oil and gas sector, particularly in Alberta. Now, this general concern, even though most people aren't quite yet ready to say that their health is being directly impacted today from climate change, when we ask respondents to assess their support or opposition to a number of areas that government and individuals can move towards dealing with climate change and improving outdoor air quality, you find broad support. And in past research I've done, particularly in the early, I'll call it the early days of my work, about a decade ago, when we were exploring public attitudes towards climate change and other environmental issues, air quality, water quality were always the concern of far more people, right? Because it affected their day-to-day life. They understood that if the quality of the air is poor, that's going to affect my health. If the water I drink is no good, that's going to affect my health. But what we find is we get almost universal support for investment in research to prevent and predict wildfires, reducing our reliance on fossil fuels, especially for generating electricity, providing incentives for EV purchases and infrastructure. You're getting almost 80% of people or more saying they support action in those ways. It's a sizable number saying they strongly support action. Investments in more public transit, and even providing rebates for heating appliances that reduce the use of wood stoves gets you to sizable numbers, right? So any of these items would win massive majority governments if these were the ballot issues on an election. And it shows that we've come to the point now where, except for small pockets in certain parts of the country or among certain political orientations, there's not a lot of friction or resistance to these ideas going forward. That I think people have come around to the fact that we have to do this. They're gonna be ways to deal with climate change, and we have to move forward. But the macro decisions we make are also related to the micro decisions we make. And so we asked people in this survey, what 3 things would you be willing to do of this list to improve air quality and protect yourself and other Canadians from air pollution? And you can see that you get almost 60% saying, well, I'm ready and willing to reduce energy use in my home. You get now more than almost 40% of Canadians saying, I am willing to buy an electric vehicle. So good news for David's team at GM, and that the demand for EVs is growing, and it's growing pretty quickly as infrastructure improves and people start to realize not only is it economically the sound choice, but it's good for the environment and climate change. And you can go down that list. Traveling less by air, the pandemic's going to help, I think, push that along. Carpooling, wearing a mask during periods of poor outdoor air quality, and even reducing the use of wood stoves. You get 1 out of 5 Canadians saying that's something that I'm willing to do. So we do see a real strong desire of people and recognition that they have to do something, and their willingness to do something on their own in their day-to-day lives. Lastly, we asked people to rank the following consequences of climate change from what they perceive to be the biggest to the smallest impact on their health. And what you actually find here is there's very mixed views, right? That depending on where you live in the country, depending on your perceptions, there's no one of these that people say that's the most important or the greatest, will have the greatest impact on my health. For some, more heat waves and associated poor air quality is really important. Higher levels of pollen and mold in the air. Note, we did this survey, and I'm going to ask Chris to talk about pollen in the air this spring, but you heard anecdotally conversations about it. Felt like this spring there was just so more. So I think if we asked that question today, we'd probably get a much higher response. But extreme weather events, flooding, and forest fires, all of those are areas. But there's no one silver bullet that people say this is going to be a real problem for me going forward. So that gives us a quick snapshot, and in my mind, I think it shows both opportunities and a little bit of risk, right? That the public hasn't fully formed their views, don't fully see a link between climate change and their lung health and air quality, but you're starting to see evidence that they're moving in that direction. And so the work that, for example, Joe will talk about, the work that your association does in having physicians talk about environmental issues and really highlighting the link is really important. So that is a quick look at the data, and I think helps us set the stage for where we are. So let's have a conversation about this. Our conversation is going to be structured around 3 theme areas. The first, we're going to look at what the problem is, and we're going to talk about the impact that climate change is having on our health, and in particular our lung health. Then we'll look into what some of the solutions are. And then lastly, we'll talk about what do we need to do to mobilize action, both at the micro level in terms of individual actions, but also perhaps more importantly for our conversation, the policy choices that governments, particularly the federal government, can make in moving climate action forward and mitigating the effects that climate change is going to have on our lung health. So I want to start our discussion by inviting Chris to come in, and really, Chris, help us understand the science behind the relationship between climate change, air quality, and our lung health. Because as you saw in the data, most Canadians believe there will be an effect, but most aren't yet willing to say that it is affecting their health in any real way. What does your research and other research tell us?
Great, thanks. I am full of so much excitement. I'm going to have to contain myself and stay focused, but maybe it'll help by sharing this. I think I gave myself the option. We'll talk around this slide a bit, and you mentioned the science, David. There's a lot of science in this slide, and one of the issues that's not in this slide, but I thought about it a lot as you were speaking, is that a couple things are noteworthy about our time today. One is, I don't think, I could be wrong, at least in the panel, I think there's not a social scientist and there's not a government slash policymaker, at least not at the government level. And that's interesting, right? Because a lot of the data you were showing, David, and a lot of what we know is that this is as much about social science as biological science. So I'll talk a little bit about the slide in front of you, which is kind of the biological science, but why are people not picking up these messages? Why are, for example, only 19%, I think was the number, willing to decrease wood stove use, when really wood stoves, for example, probably put out more particulate matter per energy unit than almost anything else? Why is there so much concern about wildfires, but not willingness to get rid of wood stoves when what's coming out of those 2 equations is the same kind of threat, generally speaking, to our lung health? So there's so much social science there, and there's so much political science that relates, of course, to political administrations coming and going and short-term thinking. And I'm not a political scientist, so I shouldn't say more, but I certainly think those are important parts of explaining what we see. But just so people do have a basic understanding, I hope this what you see is enough to at least start the conversation about these factors that I relate based on the science to the climate. And of course, we know that climate change is not always a warmer climate, but it generally is. And with that is going to come heat itself, which in and of itself is problematic to the lungs, because with heat we have to breathe harder, so we breathe in more. Warmer climate clearly leads to fires. Every one of these I can show you volumes of primary data. Fires with particulate matter, which is what PM is. Allergens, which come not only directly from fires, which release allergens, but heat itself and temperature itself leads to more release of allergens and bigger allergen spores, etc. And then ozone, another part of the air pollution mix, which is a gas that is toxic to the lungs. Each one of those is bad enough, but we know from our work and others that there are synergies, and synergies is a fancy way of just saying that the sum of more than one of these is greater than just simply adding it together. So there's a compounding effect, if you will. And I can essentially leave it there so we have more time for discussion. But these are major, profound biological effects that we see, including just recently. I'll put in the chat a bit later as we talk about other things, a study that just came out recently showing that in children, their lung function is impaired by the combination of particulate matter and allergens. So there's a whole large volume of literature to support this. And hopefully that gives you the basics of why we're so concerned.
And so just to follow up on that, the research is showing a direct and clear link between changing climate and the conditions by which and actual, the health of lung health is declining as a result.
Yeah, and I'm happy to share this. What I just showed you is one of a full PowerPoint that I actually presented to the Canadian Thoracic Society in 2019. And in there, each of or a large number of the studies that make that very case, David, in much more detail, is there. So I'm happy to do that.
That'd be great. If you have it available, you can always put it in the chat so folks can access that. That would be great. Evan, I'd like to bring you in. Your team has been exploring the connection between climate change and air quality around the Greater Toronto area. I assume any findings you have can be, applicable in other parts of the country. What have you found? And in particular, if you could speak to not just the health effects, but the associated costs. It was really interesting in our pre-conversation. You talked about the cost of air pollution to society more broadly.
Yeah, absolutely. So kind of the thing I think here is just picking up on Dr. Carlson's point around, why people might not equate the two together is because I think people are waiting for climate change to hit like a hurricane. It's not going to be, suddenly it's not going to just be on the horizon. It's around us right now. And what's driving climate change is what's also impacting our health. Like it's the same things. It's very much the same things. So there was a really great study done, and this is more just general health, but it was done by a group called Climate Choices, and they did a study, and it was international, mind you. So we'll start on the high macro level. It was that if we don't address climate change, it will cost societies generally about $100 billion in the coming years, just in terms of health impacts. And so that's hotter summers, that's worse quality air, that's the implications of all the current implications after that as well. In Ontario, though, we already know this linkage. We've already seen the link between climate and health together when we're talking about addressing our actions. And a really good example of that, and Dr. Vypond might pick up on it as well, but it was the coal phase out. I mean, there hasn't been one single greater individual climate action as well as health action in Ontario than the coal phase out. I mean, we were having something like 53 smog days a year in 2005. Like there was this orange haze that just constantly sat over Toronto. If you ever drove down the 35-115 south, there's this like bend in the road. I vividly remember as a kid, you just saw this like orange haze over the city. It was disgusting. And it's largely not there anymore. And it's largely because the coal phase out. So like this is important because like these are connected. But that progress is in jeopardy. And there's a reason why climate change is continuing to get worse, and why in TAF's inventory every year, we show that emissions are getting worse from buildings, they're getting worse from vehicles, is because like what we're using for our electricity grid, and this is where I want to touch on that building point I was making earlier, was that as we begin to transition as things get older, like nuclear plants and other infrastructure, we use other things. And in Ontario specifically, we're using gas plants, and other provinces are as well. And that's a huge problem because natural gas, which we kind of talk about as fossil gas to be a little bit more clear when we're talking about the different types, because there are different types. The natural gas that's like in the Enbridge pipelines, the demand for that in your homes and in buildings and whatnot has stayed relatively flat over the last number of years because of efficiency and other government programs such as demand side management, which is really important. But the one area it's ramping up in is electricity, and it's ramping up massively, and it's going to in the next few years. So Ontario likes to sit on its high horse saying, oh yeah, 90% of our grid is renewable or low carbon right now. That's not staying that way in the next 5 to 10 years if we don't take serious action. It will drop precipitously. And that's a really important point to make, because the gas plants are in your neighborhoods. They're nearby. They do damage to your lungs. So when we're talking about EVs, of course it's important to have the infrastructure and to transition the fleet. But if what we're using to power those EVs is really bad energy sources, it's better than getting rid of that tailpipe emissions, obviously, but it's still really bad. And in terms of your homes, natural gas is what's used in your homes as well. And so, the doctors can point to this a little bit more, but, the use of natural gas appliances versus, say, electric appliances, for kids especially, the numbers are in. We know that if you have gas-powered appliances in your homes, up to a quarter to a third of more kids will have asthma growing up. So this is connected. Like these connections are like without a doubt. Like these are not minor numbers. This isn't like modeling and tinkering on the sides. On the transit component, I don't want to go on too long, but on the transit side, we also know that for Canadians, generally a third of Canadians live within 250 meters of major arterial roads. In Ontario, that number skyrockets to almost half. And there's been some great modeling done by Professor Evans out at U of T that demonstrates how bad that air quality is, and that's tailpipe emissions. And so, these are intrinsically linked with one another. Reducing tailpipe emissions and EVs and whatnot, it's not some pie in the sky like tree hugging thing. It's your health, it's your lungs. And if you've ever lost control of your lungs, I had bronchial pneumonia a number of years ago, you really appreciate your lungs after you can't use them. And so the way to really think about this is, if it's bad for the planet, it's bad for you. And so that's like, it's just that simple. We're not disconnected from what goes on Earth. We are a part of it. We live it, and you breathe in these things. So, if you have two things we need to target, it's natural gas right now in Ontario and elsewhere for that matter too, as we transition, but then also tailpipe emissions and getting ready for the EV future and making sure we have good energy for those cars.
I just quickly want to bring Joe into the conversation, just to maybe speak to your experience in Alberta around what Evan said in the phase out of coal and the work you're doing there. How was that perceived by the public and stakeholders that you were working with in terms of pushing that forward? Was it fairly easy to do, or was it like where was the resistance to that?
Yeah, I mean, I think the thing that's motivated me from the beginning is this idea that we have an existential crisis in the climate crisis, right? Like that if we don't deal with this, we could have an extinction event similar to some of the major extinction events in the past. And I'm a big fan of civilization, so I want to support it and keep it going as long as possible. I really like hot showers and stuff. But that framing doesn't work for everybody. There's a lot of doubt that's cast out there. And so what the coal phase out recognized very quickly is that the health co-benefits were much better frames for this discussion than the climate benefits. And where we as physicians play a role is we connect that, that concern about air pollution to personal health. Up until recently, if you remember, the biggest frame was you better act on climate change because the polar bears are going to die. And what I think we've realized over time is that framing doesn't really work, because even though polar bears are cute and they're anthropomorphic and cuddly, well, not too cuddly, but on picture anyways, is that most people don't change their behaviors related to polar bear health. They really care about human health. And if you really make it more stark, they don't really care about human health, they care about their own health. So they care more about the health of their own and those that they love more than, say, the health of someone in Pakistan or in Africa or even in the UK. So what we as physicians are able to do is make it more immediate, and that impact on the immediate health of hundreds to thousands of people in Alberta was more important for the public than that of potentially millions to billions 25, 30, 50 years down the road.
Right. Yeah, and I think I also think, you know, you see what China's trying to do and try to move quickly to improve their infrastructure. It's almost entirely driven by air quality because the government there is scared a lot that the public is going to say you are killing us and you're not moving fast enough. And so politics and policy are kind of colliding with air quality there to move China pretty quickly, right? That they realize if they don't act, they're going to have a very angry population. Who
And
feels
Evan wisely points out that this dash to gas, this wholesale move towards natural gas electricity production, we lose some of that framing because, fortunately, natural gas doesn't have the PM 2.5 that Dr. Carlson was mentioning. The PM 2.5 co-benefits of eliminating natural gas because it's pretty PM 2.5 clean. There are other pollutants associated with it, but not that one, which is probably the most deleterious for human health. So, but still very dangerous. I don't know, my math's not good, but a general natural gas plant lasts 30 to 35 years. We're supposed to be net zero by 2050. It's 2021. Math's not working out if we're building new gas plants right now.
So let's talk a little bit about some of the solutions then. So I think, you know, thanks to Chris, Evan, and Joe for sort of just solidifying that we have a problem and it's probably worse than most people think, and its effect on us. Melanie, I want to bring you into the conversation and maybe you could share a little bit about the work that Lung Association in New Brunswick specifically has been doing to raise the issue, but also, you know, push forward some of the solutions. What have you been up to?
Certainly, thanks, David. New Brunswick Lung Association has been working on this issue for many, many years. It's an area that's near and dear to our hearts. And so we kind of take a two-pronged approach. We work with advocacy, both the provincial level and the federal level. We actually just recently launched a new subsidiary project called the Foundation for Resilient Health, in which we're doing a lot of federal advocacy around climate action, urging for meaningful action on climate change and an urgent transition to a green economy, because that's going to protect everybody. But knowing that public policy is a big machine and these things take time, we also spend a significant amount of time in public education. And being a health charity, and like Dr. Vypond mentioned, the health framing seems to really resonate with the public. You know, when we can talk about how climate change is affecting your health right now and how it could become more so, more intense in the future, that seems to grab people's attention. We also try to talk to people about just even adapting to living in a changing climate. You know, we've got changes that are starting already. We need to be adapting to them. And so this is an area that the general public really doesn't seem to understand very well. And so there's a big need for public education. So we work both on teaching people how to reduce their personal emissions and also, again, adapting to living in a changing climate, and really trying to see that there are benefits to taking these climate actions, you know, even if you don't necessarily, you aren't motivated by climate in general, but maybe you will see the benefit to making some actions like making your house more efficient by, that's going to reduce your greenhouse gas emissions, but it's also going to make your home more cozy, and you're going to spend less on your energy bill and those sorts of things. So that sort of messaging is kind of how we approach things from a two-pronged approach. And we do a lot of public education on moving to electric vehicles. In New Brunswick, our grid is pretty green to start with, so we don't have some of the same concerns that we've heard from the panelists about Ontario. But we do run education and awareness campaigns around electrification of vehicles.
And speaking of electrification of vehicles, David, maybe you could speak to, GM made a bold commitment to basically go full EV. Maybe you could speak to the company's plans. Also, if you could share, what it means not just for the eventual impact on our health and climate action, but also the economic impact, because I think that is a big part of this equation that for those that are resistant to support action or believe climate change is happening, they always point to the economic impact. But GM's made a big commitment to invest in Ontario. Maybe you could speak to what your company's doing.
Sure. Yeah, thanks. We're making a very big bet on changing the all the light duty vehicles that we produce and sell to make them full battery electric vehicles. Or we're also going to try and help get into other people's business, and with our hydrogen fuel cell business to help the big semi trailers that we see on the highways actually be able to convert over to zero emission. Locomotives is another area that we've invested in, and whether it's our battery systems or our hydrogen high-tech fuel cells for aviation, for locomotives, for whatever. This is a huge opportunity. So yes, it's a big bet, $35 billion that we're putting into the business by 2025. So we're putting all our cards on the table and moving towards that. But there are public policy challenges to get there. And just to put a little context around this with regard to, passenger vehicles, because that's something that many of us, or most of us, can change. That's something that that we have an ability to do something with. And so when we make a decision around the next vehicle that we have, technology in terms of air quality has been sort of the big thing that we've relied on in being part of the problem and fixing it. And a lot of people don't sort of understand, what comes out of the tailpipe of your car, but it's NOx, SOx, and particulate. And the solution to that for the auto industry since the 1970s has been technology, which has really been the provision of catalytic converters onto our vehicles, which is something that we initiated at GM and put forward. And just to put context around that, the new vehicles, even the full-size pickup trucks that we have, people were picking on wood stoves earlier today, but if you burned a cord of wood in your wood stove over the course of a winter, you would have to drive a full-size new SUV around the circumference of the Earth 17 and a half times to be able to create that much particulate. So that's just to say that the new technology is good on particulate and it's good on NOx, SOx. But there's a lot of older vehicles that don't have that brand new technology. So if you go back 12 years and you go to that highway that Evan talked about, a lot of those vehicles are going to be old. So what have we done about that? Well, we've gone to the government and we said, one of the things you could do is incentivize people to get old technology off the road. And, whether it's a cash for clunkers or something, give people an incentive, because we know in the car business that money moves the metal. And so if you give people an incentive to get into a new electric car instead of the 12-year-old vehicle, you'll have a big impact on that particulate. But here's where we join into the climate change, because climate change is every bit as much of a challenge going forward. That's why we need fully electric vehicles, because everything that Chris and Joe and Evan have said, and Melanie, rings true for me. So really the solution is vehicles that, from at least our perspective, we can offer a customer a vehicle that's fully battery electric. But the challenge there, and our polling is very consistent with what you've shown, Dave, is that people are saying, I'm very interested in an electric vehicle, but I got two big problems. One is I don't see the infrastructure around me to be able to charge it. I live in an apartment downtown. I can't plug in. That's a big problem for me. I lose sleep at night because I'm converting our entire lineup to electric vehicles, and people are concerned that they won't buy them because we don't have enough charging around us. And we are way behind what the United States under Joe Biden is trying to do in Canada. We've got to pick up our socks on investment in charging infrastructure. The other big thing is the price, because right now, battery electric vehicles are quite a bit more expensive than electric vehicles. We've had a good initial rush for rich people who like to buy electric vehicles. But if we want to get everybody into electric vehicles and all sizes, because Joe will know that if he's in Alberta, people drive pickup trucks, and that's what they need and they want. Well, we can fully battery electric pickup trucks as well. But in the transition, we're going to need consumer incentives to get people to make that switch now. And then our job is to change the battery technology so that the cost comes down below the cost of an internal combustion engine. Then I'll make more money than I would have made selling it as an internal combustion engine, and I've got a virtuous cycle. then I can do all that. But it's going to take us probably 5 years to be able to, from where we are now, to get the technology to the stage where it is at cost parity with current technology. That, as I say, that's our job, but we're taking it on, we're betting the farm on it, we're going to do that. And we're going to help to try and do the same thing for other segments, because all the sources of GHGs in Canada, all the vehicles on the road, the light duty vehicles that you and I drive, that's 12% of our greenhouse gases in Canada. But transportation is 35%. And so if we can help the trains, if we can help the big semi-trailers, if we can help the airplanes with other technologies, that'll be an important part of it too. But as I say, it's going to take a village, and I would love to see the government get more serious in Canada on charging infrastructure and on helping people to make the financial decision to move into a fully battery electric vehicle.
Well, thanks, David. And I think you're right. I've seen it in other work we've done too, that consumer confidence is going to be key. There's an intent there, as we showed in our survey and others, to want to buy an EV and to make that transition. But until they feel 100% sure that they can get to where they need to go and there's going to be infrastructure along that way, they're not going to pull the so-called trigger. Yeah, really good. I've seen lots of hands up, which is great. Chris, I'm going to come to you later because there was a great question about radon, and I know you wanted to answer it from Kelsey. But Evan, did you want to respond or say anything related to what David shared?
Yeah, just really quickly to David's point, because he's exactly right. It's work that the Atmospheric Fund is really undertaking, and the GTHA generally. And this is a little inside baseball, but there's a really good a number of standards that are coming around right now called green development standards, and it's helping to push, especially in Toronto, to more EVs. And so actually City Council will be examining increasing the tiers in Toronto from tier 3 to tier 4, with increasing the number of EV required charge ready spots. So that's not requiring like a Tesla supercharger everywhere, but just so that going into the future we can have it. And there is an argument that we should go a lot further. In fact, Vancouver and Richmond are far and ahead, leading the pack with 100% EV-ready spots in all their buildings, because it's way cheaper to get these buildings right now as opposed to having to retrofit them later, which is massively expensive. So it's one of those things where when you buy a car, obviously, you keep on advocating for, make sure you're asking about the EV type cars on you're going to buy them, but also when you're going to buy a building or a car rather, or sorry, an apartment or a home or whatever, that when you're looking at your developers, they are not all equal. A home is not a home is not a home. There are different standards in different municipalities, even in Ontario, for the quality of the type of home you get. It's not all equal across the board. And the developers only move so much as the population pushes them. And it's really important to note that, because there are some great developers out there. Certainly, I don't want to knock the good ones, but it's important that the population also, if you're thinking about individual actions you can take, because like we hear it all the time on climate change, it's like, oh, it's such a big issue. What do I do? It is just that kind of constant advocacy, mentioning it to the sales agent, whether it's for your car or for your home, it's mentioning it to your elected official when it comes to these sorts of things, or your local counselor. I cannot stress that enough. Talking to your local counselors about things taking place at, like, say, City Hall or whatnot, when it comes to like standards around the environment, or a climate declaration emergency with some teeth in it, like we saw in Toronto and Halton Hills and other jurisdictions, that pushes them to do the right thing. And often, from TAF and other organizations, we build on the great work of grassroots organizations locally. So if you're talking about, addressing these issues of buildings and transport, and then having those types of like EV ready issues, to be honest, having worked in politics, politicians only go so far as you push them. And that's a really important point to make. And I'm not talking about lobbyists, I'm talking about like people power, because if 100 people write in on an issue, that scares the bejesus out of people, and that does get them to do the right thing. So that's just my advocacy pitch for anyone looking to make a campaign.
And Joe, you had your hand up there. Do you want to add something?
Yeah, I'm just going to echo everything. So, because Evan just stole all my thunder of all the thoughts that I had, but maybe I'll just say it in a different way. My other hat over the last 16 months has been being a COVID advocate. And I think the thing that's been so amazing is that you actually see the effective policy happen in real time. Well, in 2 weeks. So somebody enacts a policy, 2 weeks later, you see that in the numbers. And what is clearly evident is that personal responsibility is super hard. You can't do behavior change on please do behavior change. It doesn't work. What you need is systemic level change. You need policy. And that's what makes the difference. Laws, carrots, sticks, not please can you be better human beings. And so this all comes down to this idea that it's great to do your individual action, but everybody who cares about this also needs to be involved politically in pushing for real change at the policy level, at all levels of government.
Joe, maybe can I put you on the spot and say, what would be one thing you would do then to force a change?
Oh, I'll give you a couple.
Okay.
Rumor has it there's a political event coming up maybe in the fall called an election. Get involved, support those policy makers, or support those candidates that will make the policy that you want, and push those candidates to put forward policy that you would support. So that's like the simple every 4 years or every 2 to 4 years action. And then get involved in grassroots or other campaigns. So join climate organizations, support organizations that are leading for change. The Atmospheric Fund, New Brunswick Lung Association, Canadian Lung Association, the Physicians for the Environment. We're all starving for funds and for volunteers. So put the two most valuable things that people have in their lives are time and money. So pick what you can offer to those organizations.
But just David, I'm going to bring you in here because building off what Joe said, like forcing people, mandating things to happen. We showed in the pandemic that when you force people to wear a mask and they have access to masks, almost everybody will wear one. I know that, the automotive sector in Canada, is not thrilled about a mandate to force, a transition to like force a ban on gas-powered vehicles unless the infrastructure is there to allow people to use it, right? Is that, and so mandates are powerful if the follow-up is there, if people have access to the things they need to make that transition.
I do actually have faith that people and even companies do try and do the right thing. I mean, I'll give one example that picks up on Joe's point. When COVID hit, I had an empty factory in Oshawa and had no mandate of anything to put into that. So we converted it and made face masks. We made 10 million level 3 surgical masks. And I never thought I'd see the day that I went and got a medical manufacturing license for the Oshawa production plant, but we converted it and we made masks for Canadians, and we did it at no cost. So sometimes people do the right thing. I think the move to electric vehicles, that horse is stampeded out of the barn. This is a competitive area right now where the company that can get the best battery technology and the best vehicle into the market wins and will take share from the others. And it will be a transition over the next 10 years. So you can, mandate the manufacturers, sure, knock yourself out, but that's not what's going to make the difference. What's going to make the difference is incentivizing people who buy the vehicles. The vehicles are here. I mean, there's about 50 different electric vehicles in the marketplace in Canada right now. If you want to buy one, call me afterwards. I got one to sell to you. No problem. The Bolts, the Chevrolet Bolts and the Chevrolet Bolt EV. And in the pickup truck size, what better than a Hummer EV? We've got them in all sizes coming at you right now. But what we don't have right now is enough incentive to get consumers to adopt those vehicles as their choice, because they tend to be more expensive now because of the cost of batteries. That'll change over time. We've got to get through the next 5 to 10 years with those incentives. So number one for us is we've got to have the government putting money in. In the United States, they're doing that big time, but we're way behind. We're anemic. We're not ambitious enough in Canada in terms of the incentives to get people to make that switch. And then secondly, the charging. infrastructure. Again, people have range anxiety. They have worries about, will I be able to do what I need to do, what I'm used to doing? It's an easy decision. I'll just go and do what I'm used to doing. So we need to change consumer behavior. That's why I'm so interested in your poll, David, because it reflects that people want to make change, but we also need to understand the barriers that are in between that change and actually getting it done. Going past a law, it won't make a difference. The vehicles are coming. What you need to do is actually get the money on the table and get the chargers in the ground.
So let's talk a little bit about mobilizing for action then as we wrap up sort of the last 10 minutes of our conversation here. And by the way, I think we could fill another hour. So thanks so much. And for all the chat going on and the questions being answered, Chris, thanks for answering so many of those. First off, I think, and this was mentioned, I think, a couple of times, the framing of climate change and climate action, I think, is really important. I mean, that's a lot of the work that I do, is trying to figure out, how do you communicate and persuade people to take action, and moving away from to Joe's point, let's save the polar bears, to what Evan said, which is, if it's bad for the earth, it's bad for you. My sense is, looking at data and looking at where sort of the political landscape is, that you can actually find greater consensus for climate action if it is framed around lung health, air quality, pollution, and less about, big existential questions that people don't feel, right? Is there anything else from the pandemic that can teach us about our ability to galvanize people to act? Because beyond, there's lots of conversation about EVs and transportation, but there's other things we can do. Chris, you've got your hand up. What do you take from the pandemic as evidence that we can actually do this?
Yeah, thanks. I was kind of wanting to talk about this, but also hesitating because I don't want to be a downer. So I'll try to keep it optimistic. But it does concern me that, we're already seeing how early in the pandemic, there was a lot less travel. There's now an insane number of studies about the reduction in air pollution from the pandemic. It's one of the quickest mobilized set of data I've ever seen, and it's powerful. But we're already seeing that with the pandemic improving, people are right back in their cars. Not only did the air pollution drop, but there are studies that are a bit more controversial because they're more complicated, but showing that drop in pollution is associated with health effects benefit. And even if the studies are complex and slow to be published, it's almost impossible to imagine that improvement in air quality was not associated with health benefits. It would go against everything we know. So the fact that there's no clear-cut there's no clear-cut political or other willpower to capitalize on the decreased emissions that came with the pandemic, but rather, the economy was hurt. Let's get back and go full steam ahead with as much transportation and everything else as possible. I mean, again, like I think it was maybe Joe that said, we all understand, I'm in a beautiful office here and with a computer that requires energy, et cetera. And I get it. Like, I don't want to be a hypocrite and pretend that I live in a cave, but we can definitely do better. And it's, I guess the optimistic part is we're still at a juncture now that the world is still got attention to COVID, and to the extent that we can remind people that air pollution kills many, many more people than thankfully COVID ever will, 9 million people a year. The more we can remind people that, hopefully we'll have at least some modest effect in decreasing the use of fossil fuels.
Melanie? Oh, there you go.
Sorry. Another piece that really parallels climate change and the pandemic was, we're in this for the long haul. This is not going to be a quick fix. We need to change our behaviors, and we need to change them long term. And all of that needs to be supported by our decision makers, keeping human health, at the forefront of all the decisions that are made. If we continue to make our decisions based on the bottom line and increasing profits year over year, we're going to see declines in health year over year. So we need to take a long, hard look at, what's most important here.
So mindful of time, I guess one last question, if everybody wants to quickly go around the table. Again, one of the primary goals of our session is to identify policy areas that you think, let's focus federal policy right now, that you think could make the biggest impact in moving the country along and getting us to do things that are better, whether at individual level or at a macro level. What's your recommended single policy option going forward? I'll start with Evan and then Melanie, and then we'll go to Chris. I'm going to put you on the spot, Evan.
One? You're making me pick one? Okay, well, it's a current one. It's one most of the parties have committed to anyways, but it can go further and it needs to be improved a bit. And the GHGs need to go, and the GHG reduction needs to go a lot higher. And it's probably the second most important climate initiative this government has done, and no one has ever heard of. It's the clean fuel standard, or the clean fuel regulations. It was originally slated for 30 megaton reduction. It was going to impact things like gaseous and solid fuels as well. It's been scaled back due to industry complaints, and has just gone back to liquid. There's a logic there, which, there's a bit of debate, but the importance of it is it's around 22 megatons. It needs to go further. It needs to go increase a lot more. There needs to be a few more safeguards imposed on it. And I know this is very inside baseball for no one that's ever heard of it. But in terms of when it comes around to the election, what you want to hear from elected officials is a commitment to the clean fuel standard and an increase to it. As well as, and I'm going to cheat, David, I'm going to pick another one, but better fuel regulations as well on the federal scene, increasing the amount of the efficiency of our vehicles to the point where it's a de facto phase out of internal combustion engines, because that's really where you want to get. You want to start getting the clunkers off the road for sure, that's existing, but all the new cars also need to increase their efficiency, and those deltas will start to intersect where it comes to how good of a car someone buys and the expense of it. And it's not, you're not necessarily forcing someone to make the right decision. You're kind of incentivizing it in different ways, just through those sorts of things. But it's the clean fuel standard because that impacts the planes, our trains, our automobiles, and everything else, and hopefully even the heat in our homes, but as well better efficient cars as well. And there's a lot of nuances in there, I'll admit, but yeah.
Thanks, Evan. Melanie, Chris, and then I'll go to David.
One of the major concerns that I have about some of the policies that I've seen coming out lately is the inclination that biomass burning is a climate neutral solution. But in fact, there's a lot of PM 2.5 and a lot of black carbon released when biomass is burning. Black carbon is as a climate forcing agent, so it could potentially exacerbate, move things along quicker. So I think the way to address this from a policy perspective is to implement sort of a health or a climate lens in all policies going forward, so that everything that we do is doing it for the betterment of the human beings on this planet and the planet that supports the human beings.
Thanks, Melanie. Chris?
Yeah, I think I support everything I heard. I would throw out there, although I do it gingerly because I'm not enough of an expert to speak strongly to this, but I am inclined to support a carbon tax. But again, don't take this out of context because I realize it's much more complicated than I understand. But what I can say definitively is government support for science is critical, and we've seen attacks on that repeatedly, and I'm not afraid to say that the Harper administration was one of the most egregious. There's lots of evidence for that, and I can equally call out the Trump administration. So these make a major difference in our understanding of how things work, and of course, without that understanding, we really are lost. So a huge call for ongoing and increased support for science.
Thanks, Chris. David, and then Joe, I'll let you wrap up.
Well, I'm going to go a little like Evan because I think picking one top solution's a bit of a challenge. There's an old adage in industry that that just picking one sort of regulatory solution is kind of like, and I'll say this because we've got doctors on the panel, it's sort of like saying we're all overweight. And the solution to obesity is that instead of focusing on exercise, instead of focusing on what we eat, instead of focusing on the environment, we're going to mandate 32-inch pants for everybody. And so the solution will just be that we'll have a mandate of 32-inch pants, and everyone will get skinnier. Unfortunately, these things work together in a system. And in my industry, in the auto sector, it works together in a North American system. And so my one wish would be that I think we are going to have a lot tougher regulations. I think that's a good thing. I think we're going to have a lot better technology. I just want to have Canada have jobs to go with that when we adopt and make that change. And so I hope Canada is really going to align and make sure that we get the best out of it so that we can continue to keep people employed with these green tech changes that are coming.
Thanks, David. And Joe, last idea to you.
So I guess in the theme of changing the question to fit your answer, I'm going to talk a little bit about all levels of government. And I think we can see that as the coal phase out continues, the next major source of pollutants and GHGs is going to be the transportation sector. And I think electric vehicles have their place, but I think we have to recognize it's not the be all and end all of the solution. So, hey, active transportation. Active transportation means both biking, walking, and transit. And there's multiple studies that show that we're talking about co-benefits. The co-benefits of active transportation is massive. It helps obesity, it helps mental health, it helps the planet, and it helps cities, because once you start building for people instead of cars, you get better cities. And look at Paris. Look at what Paris has done in the last 12 months. Wow, we could all be so lucky as to see that kind of transformation in our own cities. So yeah, shout out for active transportation.
Well, thanks, Joe, and thanks to David and Chris and Melanie and Evan for just making my job really easy and filling the 45 minutes of our conversation. And thanks to the audience. Terry, I will hand things over to you to wrap up, but it's been a pleasure and appreciate this time to share. So Terry.
Thanks, David. Wow, what an amazing conversation, and you far exceeded any expectations we had set as an organization, and tremendously grateful. So on behalf of the Canadian Lung Association, I want to thank our panelists for just tremendous contributions, really creative thinking. This conversation has been a really critical step for us as we look at what we're going to be doing going forward, certainly to make better air quality for all Canadians, coast to coast. And the panel did represent us from coast to coast, which is a wonderful thing. I also want to thank David, skillfully moderating today's session. That was awesome. Linking what we saw from the research into reality of what the folks are seeing is so critical for us. And that's part of it is let's make this thing real going forward, because it has to resonate. We cannot allow the things that are happening today to continue. And obviously, I want to thank everyone who took the time out of their busy schedules to join us as the attendees for the session. Saw some really active conversations in the chat and the Q's and A's. That's what we want to see when we host these things, engagement. So this is a first step, one of many that we have initiated before, but we'll continue to push forward. And, we heard it takes a village to move these things forward. So please watch for an email from us. We want to continue to engage you in this discussion. If you would like to, we'd be tremendously grateful for your input, because as big as we may be, we can't do this alone. It will take many actors in this to move things forward. So I want to thank you for your time today. Do enjoy the rest of it. And above all else, please continue to stay safe. Thanks so much, everyone.